Hello and welcome to Progressive Education Society's Modern College of Pharmacy e-lecture in the subject Natural Drug Technology.
Myself, Dr. Bhushan Pimple. In this video, we will discuss about the Vati or Gutika, which are also known as tablets or pills. Vati Gutika, as per the definition of Ayurvedic pharmacopoeia, are medicines prepared in the form of tablets or pills. They are either made up of a single drug or more than one drug. They are mostly of herbo-mineral origin or herbal alone or animal source drugs. Drugs of animal source are utilized or only drugs of mineral source are taken. So depending upon the formulation, the composition varies. Now these are vatis and these are gutika, that is pills and tablets. The pills are rolled between the palms and tablets are punched. These are few of the common marketed formulations like Khadiradi Vati, then Sukhasarak Vati used for constipation, and Raktavardhak Vati for blood purification or blood disorder, treatment of blood disorders. We'll have a look at the method of preparation of these formulations. Initially, cleaning, drying, and the pre-treatment is the first step. That means all the raw materials or the drugs prescribed are to be thoroughly cleaned and dried, and then, if mentioned, pre-treatment is also to be given. Like we'll see one by one. Generally, mud or foreign matter is adhered to mineral drugs or herbal drugs. So that needs to be removed first. Then the drugs are either sun-dried or shade-dried, depending upon the thermolability or thermostability of the phytoconstituents. If minerals and metals are mentioned in the formula, they need to be converted into ash or oxides. That is, bhasma is prepared. And if heavy metals or toxic elements like mercury or some sulfur, if they are mentioned, they need to be first converted into rasa sindura, which is also called as kajjali. The method of preparation of kajjali we have already discussed in rasa rasayana formulation. Other drugs, for example, besides these drugs, whatever the drugs are mentioned, like say suppose herbal drugs and all, they are finely powdered and are added one by one. If there are more than one drug, they need to be added into succession. Second step is grinding. The clean drugs or treated raw materials are ground in a mortar along with prescribed juices, like say suppose sometimes buttermilk, milk, water, cow urine, or juices of certain plant materials or leaves or fruits are prescribed. So they are mixed along with the cleaned drugs powder, and a thick paste is formulated. If more than one liquid is prescribed, like say suppose milk and water, in that case they are added in succession as per the process. Succession means one after the other. If flavors or perfumes are mentioned, like say suppose generally used flavors or perfumes are musk, camphor, etc., they are to be added and the paste is again ground to fine consistency or smoother consistency. If sugar or jaggery is prescribed in the formulation or mentioned in the formula, they are first to be converted into syrups, and the syrup is then added into the paste and then added, and then the paste is to be generated. Then last step is rolling. Once the thick paste is formulated, later it is then, that is, determination of final consistency of the paste is that when you are rolling between the two fingers or between the palms, the paste should have very less amount of moisture so that it will not stick to the fingers or palms. So it should be easily rolled between the fingers. So this is the way how consistency of paste is determined. Once this consistency is attained, thereafter this thick paste is either rolled into pills. Now, the rolling into pills is like uh, preparation of laddu or rolling between two palms by application of ghee, and so that it does not sticks to the palm if you are consistently rolling it. So desired amount of or weighed amount of paste is taken and then it is rolled so that most of the pills generated will be uniform, almost uniform. And generally, if pills are not there and if you want to punch it into tablet, then as per our Sotix normal so tablets of synthetic drugs, very similarly, here also tablet can be prepared. Once the pills are rolled, these pills are either to be dried into shade or sun. If they contain flavors or camphor and all, you need to dry them in shade. Then characteristics and preservation. Pills, if they are of herbal origin, they are to be stored into airtight containers and they retain their potency for 2 years. That means you can use it up to 2 years. If the pills are made only of minerals, like so suppose calcium or certain metal and mineral composition, in that case they can be used indefinitely. That means the period shelf life is indefinite. But on storage, the formulation, that is the pills, should not change their original color, odor, or form, or even taste. If sugar or salt is added, care is to be taken that the pills are kept away from moisture. Like, for example, we usually see a Hajmola bottle in these atmosphere, like rainy or humid atmosphere, they become soggy. And the reason for that is the excess presence of salt in excess. Then evaluation, as far as evaluation of these Vatigutikas are concerned, generally they are evaluated for organoleptic properties like color, odor, taste, size, shape, and all. Besides extractive value, the pills are to be determined. The extractive value is to be determined with the help of either water and alcohol. Ash values, total ash, water soluble ash, and acid insoluble ash. Then chemical test, whichever the drug is, depending upon that, the chemical test is to be performed. Like, so suppose, for example, if they contain tannin, the test for tannin is to be done. Then TLC, again, depending upon the marker phytoconstituent. For example, in case of Khadiradi Vati, their chebulic acid or ellagic acid becomes the active principle. So those need to be determined either by TLC or HPLC or HPTLC. Then other than these are the evaluation parameters prescribed by Ayurvedic pharmacopoeia. But to determine the IPQC parameters at a larger scale, we need to apply a normal pharmacopoeial like in USP parameters or IP parameters or official ways to determine like weight variation, then friability, hardness, disintegration, content uniformity, etc. So this is the reference, that is Ayurvedic Pharmacopoeia of India, which enlists how the pills are to be prepared.